Good morning. My name is Dr. Michael Morissette, and I have my patient Jared here this morning. I wanted to show you what a typical patient looks like who has nice facial features, good facial balance, but is just a little deficient in the lower portion of it.
Yeah, so I always thought my chin was a bit recessed compared to the rest of my face, and I think a sliding genioplasty with maybe 8 to 9 millimeters would work, but I would like your input on that. I got fillers last year, but it didn't project my chin far enough.
Nope.
And I don't want to do it every single year. Dissolve really fast. So.
Right. You need like four syringes of filler. So 4 syringes of filler in our office is $3,200. If you do that every year, it just adds up and adds up.
I have a lot of fullness here. So I have a feeling when the bone goes forward, it'll pull all those muscles with it, right?
So exactly. So the chin is really interesting. The chin has muscular attachments on the inside that attach to the tongue and the soft tissue of the neck. So when you bring the chin forward, you're also bringing that musculature forward. So it's going to give him a cleaner look. Some people have a lot of subcutaneous fat, and I'll do simultaneous liposuction. You're not that candidate. Just bringing that forward is going to bring the muscles forward, and it's going to give you a nice, cleaner look in there. It's going to give you a better mandibular angle and line. You're exactly correct on that. So when I look at him, I can see that he has a very shallow mental labial fold, and that's this area here. And he looks a little short on the lower end. So when I mean short, I actually measure vertically from the hairline to just above his nose, and then from above his nose to his lip. And I feel this third is a little bit shorter. So that's one of the clues into like recessiveness of the chin. I do see some extreme cases where they need a chin implant and a genioplasty. But in Jared's case, I think if we were to just bring his chin forward a little bit, I think we'd get a nice facial balance result. Again, we're talking about facial balance here, so I'm not going to make you more handsome.
So keeping my face, but just enhancing it a little bit, basically, is the goal, right?
Exactly. Just slightly slide your chin forward for me, like your lower teeth. There you go. So that kind of gives you an idea. Now that to me just improved his facial balance. I just love this look. Go back to your normal. So when you come forward again slightly, I just feel like that third is more equal, and the jawline from the angle to the chin looks great. Go ahead and go back to normal. He's just jutting his jaw forward, but that's how that basically would turn out. So we're always between 5 at a minimum, and I don't even remember last time doing a 5, to a 6, 7, 8, 9, and 9's the maximum. Yeah.
Okay.
So we'll make a difference here. Nice thing too with this, we do an intraoral incision, so there's going to be no skin incision. The only one caveat is that when we do this surgery, sometimes you're numb after surgery for a couple of days or even a week, and so that numbness can affect your lower lip. And we would want you to be careful about biting something where you might bite your lip. You know.
Would I be able to like move my lip down or like pucker, kiss, that kind of stuff?
Great question. Great question. Yeah. Because there's 2 kinds of nerve. There are sensory nerves, which provide feeling and sensation. There are motor nerves. Now, in this particular surgery, the only nerves that we get concerned about are sensory nerves. So we're going to elevate the sensory nerves on either side out of the way when we do our surgery. Now, the motor nerves are in a different plane. We do not see the motor nerves, so movement of your lip can only be affected temporarily if there's a lot of swelling. It's rare that young people will get bruising, so my older adult patients will often have a bruised chin, bruised neck, and most people have a swollen lower lip for at least a week. I typically tell patients they can go back to work in 5 days if they feel like their aesthetics are acceptable and they're not concerned that their coworkers would, ask them a lot of questions. By and large, I think genioplasty is not a significantly painful, you'll get pain pills today. You'll probably take 1 or 2 or not. Mm-hmm. I just do not find that this is a painful operation. People wake up, they're comfortable. So even though we close the incision, the bone has marrow in it, and that's what bleeds. You might want to put a towel under your pillow, over your pillow, because you might wake up and you're drooling a little bit of saliva and blood.
Yeah, so I'm gonna lay on my back and my
You
side.
can lay any which way comfortable. Okay. If you're tired, you're like, I'm gonna take a nap this afternoon, and take a pain pill and it makes you sleepy. Take a nap, but you'll probably wake up with a little drool and it'll be bloody. So have a seat right there, Jared. This is just 2 hours out from surgery. We did a chin advancement of 8 millimeters. I used an 8 millimeter plate. I'm maybe turn forward again. How are you feeling right now, Jared?
Honestly, there's a very little pain. I feel great right now. Yeah.
Okay.
I'm a bit tipsy from the IV, but I'm pretty good.
Yeah. So we use an intravenous anesthesia technique. So it's IV sedation. So he was sedated during the procedure. I used a lot of local. Normally when you're finished this kind of procedure, the patients have a little difficulty speaking because we've numbed that lower lip for about 4 or 5 hours, but his clarity has been great. So the incision is in the front below the lip. It's in an area where you don't chew food. You can have a smoothie, a milkshake, a Jamba Juice, some ice chips right now would be great. He can really eat a diet as tolerated. Something that's presented to you that you think you could get down and chew, then it would be okay by me. Because we did an aesthetic chin surgery, we did not change the bite, or a jaw surgery where the bite might be changed, and so there's going to be no pressure back there. Expect some chin numbness and some swelling. Can he drive a car tomorrow? If he's feeling well, not taking any prescription medication, he can drive a car tomorrow. Though this is not an operation to make you look younger, to make you look more handsome, more beautiful, it's an operation to balance your face. So what we did from his pre-op photo to where we're at now is we increased the balance of his lower face by bringing it forward. It did two things. It gave him a better cervical mental angle, so he's got more acute angle. And then from the front, we basically have made it appear longer, so his face looks a little slender, but it just looks balanced. So this is all about facial balance on the sliding genioplasty. It's a really natural operation, natural result. All the muscles that we detach will reattach in their normal position, and his enunciation, his pronunciation, all will be normal after we're done. So can't drive today, but he has a designated driver, but all went really well, and he's gonna get a great result.
Much appreciated. Thank you so much.
You're welcome. Awesome job. Yeah, you're awesome.